You took your mother to the cardiologist for chest pain. The ECG was normal. You took her to the stomach specialist. The endoscopy was clear. You took her to the ENT for dizziness and the neurologist for numbness. She has a thick folder full of medical reports, and every single specialist tells you the tests are normal. She's fine, but she's not fine. She's still in pain. She's breathless, and she's miserable. You feel like you're losing your mind, and she feels like nobody believes her. If this sounds familiar, your parent might be suffering from a hidden, massive epidemic. It is not a heart problem. It's not a stomach problem. It is an anxiety disorder in disguise. When a 25-year-old has anxiety, it happens in their brain. They have racing thoughts. They worry about the future, and they feel panicked. But when an 80-year-old has anxiety, it happens in their body. The aging brain often stops expressing distress as worry. Instead, it translates that stress directly into physical pain. Instead of saying, I feel anxious about getting older, an older adult's body will say, I am dizzy. My stomach is in knots. I cannot breathe. In fact, anxiety is actually more common in older adults than depression. But because it wears a physical disguise, we almost always miss it. Because the symptoms are physical, families do what makes logical sense. They take them to physical doctors. This leads to a dangerous, expensive cycle called doctor shopping. We chase the symptom instead of treating the nervous system. Unexplained breathlessness leads to an inhaler she doesn't need. Unexplained pain leads to heavy painkillers. And this is incredibly dangerous. We end up giving them a cocktail of drugs to treat isolated body parts, exposing frail patients to severe side effects while completely missing the root cause. I need to pause here and make something absolutely clear. If your parent is going through this, do not tell them it's all in their head. Their symptoms are undeniably real. When the nervous system is locked in a state of long-term anxiety, it fires real pain signals to the stomach. It physically tightens the chest muscles, causing real breathlessness. They are not faking it. They're not doing this for attention. They are trapped in a failing nervous system, and they cannot escape it on their own. So how do we break this loop? First, we must stop the endless testing. Once the major life-threatening issues are ruled out, we need to step back. Stop searching for a phantom disease. Second, we need to treat the whole patient. If your parent has multiple shifting physical problems that no specialist can cure, it's time to see a geriatrician or a doctor who understands geriatric mental health. Anxiety is not a normal part of aging. It is a destructive condition that accelerates physical decline and memory loss. But it is highly treatable. We just have to look past the disguise. I'm Dr. Lim, and in my next video, I will explain why this exact same anxiety makes older adults so stubborn about taking sleeping pills. I'll see you then.